Welcome everyone to the Medical Minute. This is Dr. Lars Thestrup with Bellaire Fire, and today we're going to talk about xylazine and its mixture with fentanyl. Xylazine, also known as tranq, it's found in about 48 out of 50 states so far when they've confiscated fentanyl, according to the DEA. And current DEA estimates that approximately 23% of fentanyl powder and 7% of fentanyl pills seized so far at xylazine, and I am betting that number's gone up here in 2023. So what is xylazine? Xylazine is a vet tranquilizer. It's really used for sedation and anesthesia in cattle and horses, so definitely not good for human consumption. A lot of the cartels are just mixing this with their fentanyl currently. And it's coming straight from some of the cartels south of the border. So what are the most common effects? Well, bradycardia, respiratory depression, hypotension. You can have some transient hypertension secondary to alpha-1 stimulation. That's just a receptor which actually causes vasoconstriction. You can also obviously CNS depression, lethargy, drowsiness. And then you can also have these large ulcerating necrotic wounds, look like abscesses or skin ulcerations. And this is from where users inject the drug. It's actually a pretty big giveaway that they're injecting something with xylazine in it. The big question, does Narcan work? No, doesn't do anything for xylazine. You'll actually reverse the fentanyl, but you won't get any reversal from the xylazine. So what's the antidote? There is none. There is currently no antidote for xylazine. So what we're going to do is we're going to provide supportive care. So number one, manage the airway. Obviously, if no gag, they're uncontrolled airway, place an eye gel or intubate as needed. If they're bradycardic, you can try atropine, pacing as needed. And then obviously manage and treat. You can also treat some hypotension with fluids. If that's not working, you can upscale to some Levophed if need be. But all we're going to do is manage the patient the best we can, their hemodynamics, and get them to the hospital. Again, thank you for your time, and let me know if you have any questions.